goal of this presentation is understanding how to recognise nerves and their specific architecture and characteristics when scanning them with ultrasound. A nerve has different parts. One of the smaller entities of a nerve is a nerve fibre. This nerve fibre is surrounded by a fascia, the endoneurium. Multiple nerve fibres together make a nerve fascicle, which is covered with perineurium. And all nerve fascicles together create the whole nerve, which is surrounded with epineurium. Knowing this nerve anatomy and being able to recognise the different parts is important for nerve pathology recognition. On this slide, you can see on the left side schematically the peripheral nerve anatomy and all neurium layers. On the right side, you can see an ultrasound image of a longitudinal nerve. Do you see the hypoechoic nerve fascicles and the hyperechoic perineurium? The longitudinal nerve and tendon look a bit alike. In this slide, you can see an ultrasound scan of the forearm. To be precise, an ultrasound scan of a flexor tendon and a median nerve. Please note the difference. A longitudinal nerve has less hyperechoic parallel fibres than a tendon and is therefore slightly more hypoechoic. It's made of round hypoechoic areas in a homogeneous hyperechoic background. See the transverse nerve ultrasound image on the right. The cross-sectional appearance of the hypoechoic rounded areas correlate well with the nerve fascicles seen in the histologic slice in the left image. It demonstrates the cross-sectional appearance of a nerve composed of many fascicles. Here you can see a magnified transverse nerve. Please note the arrow pointing out one of the nerve fibres and the perineurium covering the whole nerve fascicle. Also interesting to see are the intraneural blood vessels, which run not only between the nerve fascicles but also inside the fascicle. The arrow in the images is pointing one vessel out, but many more can be seen. In the next 4 slides, I will use the brachial plexus and the median nerve in the arm as an example. Ultrasound examination of the brachial plexus is, although at first sight difficult, perfectly feasible with fairly rapid practical and theoretical training. Nerves can be followed all the way from cervical level, passing the scalenus muscles, leading the axilla and looking for their path in the upper arm, all the way down to the wrist into the carpal tunnel. Nerves are very adaptable and variable. They search their own path in the anatomy, where they seek a combination of protection, backup possibilities and functionality. In this slide you see schematic drawings of a longitudinal view which illustrates the models of fascicular organisation. The arrows are indicating the axonal path. In the cable model, depicted in the left image, the fascicles run parallel to the nerve axis without axonal exchange. In the plexiform model, depicted in the right image, fascicles split and rejoin in various combinations with axons intermingling from one to another. Be aware of the plexiform model if you're following a nerve. If following a nerve, the echogenicity of the nerve can change. For example, the ulnar nerve in the cubital tunnel. In this cubital tunnel, the nerve is very superficial and vulnerable to trauma. At this location, the ulnar nerve is embedded in fat tissue which acts as a shock absorber to protect the ulnar nerve. The surrounding fat tissue gives the ulnar nerve a more hypoechoic appearance. If we follow the ulnar nerve to distal, the nerve courses into the depth between the forearm muscles. Since this is a much less vulnerable spot, the muscle protects the nerve. There is no surrounding fat anymore, and the ulnar nerve has a more hyperechoic appearance. The experienced sonographer can also visualize the neurodynamics of peripheral nerves when the patient does nerve mobilization techniques like sliding and tensioning. Research has shown that neurodynamics can be assessed with ultrasound.